Hi, I'm your host, Marsha Florence for Just Ask. Today our show is the Michigan Peer Review Organization. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today our show is the Michigan Peer Review Organization, and our guest is Kathy Perkins, Medicare Resource Specialist. Hi, Kathy.
Hi, Marsha.
Glad to have you here.
Thank you for having me.
Good. Now, Kathy, I want to start off with a good question. And what is the Michigan Peer Review Organization? And give us a little history about your involvement in it.
Well, the Michigan Peer Review Organization has been around since 1984. We are an organization that's contracted by the federal government to act on behalf of Medicare beneficiaries in the capacity of patient advocates. There's a peer review organization in every state in the United States, and they're all located in the Medicare 2000 handbook under the pros. And we're all, like I said, individual organizations that are working under the federal government.
Okay. Now, Shanti, when you said the book, is it a booklet that's updated every year, or how does a person get
the
a book?
Medicare 2002 handbook, all Medicare beneficiaries receive these automatically if they're on Medicare, and they are updated every year.
Okay. What's the important message for Medicare?
The important message for Medicare is a letter. It's actually a mandatory letter that's supposed to be given to every Medicare beneficiary when they're admitted to the hospital. And this letter explains the process and procedure to follow. If you are being asked to leave the hospital and you think it's too soon, you think it's a premature discharge, you can start an appeal through us for extended stay in the hospital.
Okay. See, the average person doesn't realize that on the back of, is it on the back of the Medicare card that there's a 800 number that they can call, so that in case they feel like they're getting discharged from the hospital too soon?
Well, no, it's not on the Medicare card. It would be on the important message from Medicare letter.
Okay.
And if they're lucky enough to have heard about MPRO, we have cards, immunization cards they can put in their wallet, and we have magnets and different types of information that have our number on it that reminds them that we're patient advocates under Medicare.
Okay. Well, one of the many reasons we had you come here today is because a lot of people don't realize that this organization exists, and it's more easy to find out by way of television that if you see and hear something.
Right.
So actually, I'm impressed with the fact that if you're in the hospital, and let me just give this example. If you're in the hospital and the nurse comes in and says, Ms. Florence, you're going to be discharged this afternoon, and I don't feel that I'm ready to be discharged, what rights do I have?
Okay, the first thing that we suggest and we try and stress with the Medicare beneficiaries and also their families is when you're admitted to the hospital and you're a Medicare beneficiary, you want to ask for that important message from Medicare. But if you don't have that letter available, the other thing we want you to remember is to call our Medicare hotline at MPRO, and that number is 1-800-365-5899, excuse me. And when you call that number, the hotline staff is going to tell you to ask the hospital for a notice of non-coverage letter, which is simply a printed form with a specific date the hospital intends to discharge you. And you ask for that notice from a discharge planner, social worker, or in small areas it might be a head nurse. Okay. Once you receive that notice from them, then you are to call our hotline back, and then the process begins.
Okay. Now, would a Michigan Peer Review Organization doctor or someone come and examine the patient or something? How does one know that, okay, well, she is being discharged too soon?
We don't do on-site visits. None of our reviews we do premature discharge appeals and also quality of care reviews against facilities. Mm-hmm. They're not done by on-site. We only do by medical records. But if the situation, if we have a review that's being looked at, the medical records are requested from the facility. from the hospital, and the medical records are reviewed by our staff. We have a staff of nurses, and we also have a staff of physicians who are all in private practice, who are actively seeing patients, and they come in through the office and either pick up the records and take them with them or review them at our office for the premature discharge appeals as well as the quality of care reviews.
Okay, now it's a little scary there to know that I'm in the hospital. I just had surgery. Does ambulatory surgery count the same way?
No.
Okay,
No.
so if I have ambulatory surgery, which was 1-day surgery, but yet I don't feel that I'm well enough after the surgery, I can't stay?
No, the discharges, the premature discharge appeals are for when you have been admitted to the hospital and you're being discharged. Now, if you're in ambulatory surgery, or if you go to the hospital for another reason, they keep you through observation, and you really feel as if you need to be admitted to the hospital, we also do what is called pre-admission notice of non-coverage review,
Okay.
and that is to get you into the hospital. But you have to be very careful about that review type, because when they're trying to discharge you from the hospital, we can keep you in the hospital, and no matter which way the decision goes, there's no financial liability to the beneficiary. When you're trying to get into the hospital with the review being done, if we agree with the hospital and say that you didn't fit criteria for Medicare accepting you, then there's going to be financial liability to you for your stay in the hospital while the review is being done. So we can do a review for you in that case, but if it doesn't work in your favor, you're going to have financial liability.
Now, what are some of the reasons for people being discharged from the hospital too soon?
Well, oftentimes hospitals think that, they get paid for a certain time frame, and oftentimes they think that person is well enough to go home in that time frame. The hospitals get paid for a specific number of days, and they're not always discharging them because they don't get paid for additional days, but they kind of follow the guidelines. The understanding that a lot of people in hospital have is that the insurance company pays for a certain number of days, and that they have to discharge the patient in that number of days. And a lot of times doctors will tell a patient, I would like to keep you in the hospital longer, but the hospital has notified me that your insurance company will not cover you if I keep you past this number of days for your diagnosis. And that's not always true, because you have appeal rights that your case can be looked at, and you can stay for additional days if necessary, because they're not supposed to discharge you until you're medically ready to go home.
Okay, yeah. So that's what makes it kind of complicated, because on one end it's based on the number of days, okay, that's actually covered financially. On the other end, we're talking about a person's life.
Right.
And, and that person, to me, the person who's in the hospital is the only one who really knows, am I well enough or am I not? You know, a lot of people are always in a hurry to go home from a hospital following surgeries, but the hospital bed is designed to go up and down, and the railings and everything. You can get out of it. The home bed is flat.
Right.
You get home, you had surgery on your stomach, your heart, or whatever. It's not the same. You got to have 10 pillows instead of 2.
Right.
The bathroom is way around the hall, or better yet, they don't want to practice the physical fitness or getting up, getting out when the nurses come in. A lot of times, people to me leave hospitals a little too soon, not knowing that they're going to go home to a home environment that's standard, and that you don't have someone there with you all the time, and you don't have the same type of the equipment to keep you afloat, the food, from salt, low sodium food to, well, I'm hungry, just give me a piece of chicken or something, and that what makes a person hurry back and end up going to the hospital.
Right.
So does the peer review organization, if a person is discharged from hospital, go home, say he or she eats the wrong thing or has a relapse, can the person go back to the hospital and still be covered, or is that like a new policy? Is there any effect?
If a person goes home and they don't get any better, they can go back to the hospital. They can go back to the emergency room, or they can contact their doctor and go in to see if they need to be readmitted. In a case like that, though, what's important is adequate discharge planning. Maybe that patient doesn't need to go into the home setting from a hospital. They might need to go into a skilled nursing facility. And if they've had at least a 3-day hospital stay and require a skilled service, Medicare will cover them for some skilled services in a skilled facility for a period of time.
Okay.
Also, there are other discharge planning that can be done for a patient. Maybe the patient might need a hospital bed. They might need a physical therapy. They might need certain equipment or supplies. And that's all the job of the discharge planner when they're discharging. And sometimes we get cases that they call and they want to appeal the discharge, but when we get to the bottom line of the whole situation, it's actually miscommunication because maybe adequate discharge planning has not been made for that patient and they don't feel safe going home. So when our staff intervenes with the nurses or the discharge planners at the hospital and they all come together on what needs to be done for this patient, then sometimes it's a simple situation that adequate discharge planning needs to be made to make sure that the discharge is a safe discharge.
Okay. Now, if someone was to call the toll-free hotline beneficiary number, what information would they get?
The Medicare information number at Michigan Peer Review Organization, the 1-800-365-5899, is really set up to answer general Medicare questions. Although we can answer a variety of questions because we have a lot of resources available to us. If it's something that we cannot answer for the beneficiary or their families, we usually can refer them to an appropriate organization that can.
Okay. Now, you guys have a speakers bureau?
Yes, we have a Speakers Bureau.
Okay.
And I'm part of the Speakers Bureau. My title is Medicare Resource Specialist. We have another person also who's been doing it probably like 10 or 12 years. And the Medicare Resource Specialist, this is a service that's provided by Medicare. You know, information, health education, and patient rights information. And we do the entire state of Michigan. We do any types of groups, churches, women's groups, senior meal sites, adult assisted living facilities, any kind of community, block clubs, anywhere that we can go in and speak to not only beneficiaries, but also to the caregivers of beneficiaries and let them know what their patient rights are under Medicare. And like I said, this is all part of the Medicare service. It's free to anyone who's interested. And anyone who's listening to this or watching this today, if they're interested in having a speaker come in and speak to their group, they may call that hotline number, the 1-800-365-5899, and tell them they'd like to have a speaker come out and they'll take care of them. They'll get them set up.
Okay, that's a wonderful thing.
Yes, it is.
Because a lot of times people don't realize if you get a speaker, the same questions that you ponder at home, you get to ask them in person, and you feel more relieved that you had a chance to ask someone.
Right.
Or you can call the hotline number and still ask that same question as well.
Correct.
Okay, so it's really important for our viewing audience, listening and viewing audience, to understand that this particular organization in itself, are you linked in with the Social Security Administration? Or?
No.
Okay, so basically you stand alone.
Yes.
But in the services that you provide is to protect the interests of the client and his or her
Correct.
stay in the hospital.
Correct.
Okay.
Medicare beneficiaries.
Okay. Well, Kathy, we're going to go to a commercial break, and we're going to come back with some more good questions for her.
Thank
Be
you.
right back.
Why would anybody give someone they don't know a gift? They do it because this gift saves lives. And the need for it is desperate. We need over 20,000 people to give this precious gift every day. Please give blood. There's a life to be saved right now. Call the American Red Cross at 1-800-GIVE-LIFE.
The beauty of saying thank you is you can do it in so many ways. A pat on the back, a smile, a bear hug is always nice. So for everyone who supported our United Way, this is a pat on the back, a big toothy smile, and a bear hug all rolled into one, just for you. You reached people who really needed help, and you touched us all. So without further ado, a heartfelt word from us to you.
If you're a Medicare patient and there's a medical reason to be in the hospital, you have the right to be treated.
Do you have questions about your rights under Medicare? Call MPRO. We're here to help.
Do it all the time, huh? Hi, I'm your host, Marsha Florence for Just Ask, and welcome back to the second half of our show. And we're sitting here with Kathy Perkins from Michigan Peer Review Organization. Now, Kathy, I know someone's going to call us and ask us some questions, or better yet, call you at the 800 number and ask some more questions. And it's a good thing that you came today to tell us about Michigan Peer Review Organization. But let me know what would happen as far as like if the client or a patient is at the hospital, feeling that they're going to be discharged, and someone's supposed to look at their records. The hospital records are at the hospital, though, aren't they? And,
Correct.
okay, so a person from the organization, peer review organization, goes to the hospital and takes a look at this person's records?
No. When we start the review nurses, once they speak to the beneficiary or whoever's representing the beneficiary and tells them they're going to start the review, they call the hospital and request the medical records, and the hospital will get the medical records over to our office. It's mandatory that the hospitals comply with us. The hospitals work, when they're accepting Medicare beneficiaries, they're working under a contract also. And one of the issues in the contract is that they comply with us concerning our request. So we request medical records from the facility, and they will get the medical records over to us.
Okay.
Reviews take up to 3 days. Now, in the event, at the end of the review, maybe after the 3 days, we side with the hospital and say, well, Ms. Jones, you could have been discharged when the hospital initially wanted to discharge you. It doesn't matter. It didn't cost the patient anything. It was like having a second opinion done. So any way that decision goes, it doesn't cost them anything.
And I'm still in the hospital those 3 days?
You're still in the hospital. All your
Okay.
services continue.
Okay.
And sometimes the unfortunate part is that we are out educating the state about Medicare patient rights for beneficiaries and their caregivers. But oftentimes the hospital staff is not aware of this notice. So we're also educating the hospital staff. So that when a beneficiary requests this notice from them, they'll have an idea what they're talking about. So we also tell the caller when they call in and ask about that notice, we also tell them that if they have a problem receiving that notice from the hospital, to please call us back. Not to waste their time trying to convince that staff member that they're entitled, because evidently the staff member is not educated in that part of it. So we have them call us back, and when they call us back, we intervene for them. Then we call directly over and we speak to someone. We have an IMPRO liaison at every hospital in the state of Michigan.
Okay.
These are people who know the process and procedure for that premature discharge appeal, and they know how important it is that they comply, with us. So we call over and speak to the IMPRO liaison, and then they make sure that everything goes smoothly after that.
All right. I was wondering who's on the premises.
Yes,
But
we
if a
have someone
person
there.
if a patient feel like they receive poor services, what happens?
We also do quality of care reviews, and we do quality of care reviews against any facility that has been paid for or is being paid for by Medicare, and there are no statute of limitations for it. And if they have a quality of care issue, they need to call our hotline number, the 1-800-365-5899, and they will take general information from them, and then they'll send them a form in the mail. And then the caller will have to fill out their concerns and issues on this form and sign it and send it back. And even though our reviews are only done by medical records, we do referrals for that beneficiary or their family, because a lot of issues wouldn't be written down in the medical records. So they don't have to worry about which issues we can address and which issues we cannot. They put all of their issues down into this form, send it back, and then we will acknowledge, we'll make an acknowledgement letter to them as to what we can handle and what we will refer to other organizations.
Okay.
So we do the referrals for them, so they don't have to worry about who to refer to or can IMPRO address this. We handle all that for them.
Now, you guys got a videotape out, Medicare and You?
Yes, we do. We have a video that's available,
Okay.
and if they'd like, they can call any type of organization that would like to get an idea about the information that we're giving out or the literature. May call that hotline number, that 1-800-365-5899, and ask for the video. And along with the video, they will get information packets concerning rights under Medicare and some of the other things that go on at Medicare, the hotline, the project teams, some of the other things that go on at Medicare. They'll get all that with their information packets.
That's good. That's really good. Let's go over some of these brochures that we have here on the table, because we know there's some good information out there. So this one, Medicare and You, this is the one that probably is linked in with the videotape or something? What's this?
Yes, somewhat. It just tells you it does have information on the video that is also in this brochure, and it just tells you what your rights and responsibilities are as a Medicare beneficiary, and it kind of highlights who IMPRO is and how we can serve you.
Okay, nice one, real nice one. And protect yourself from depression. Now, a lot of people don't know it. They have depression, a mild case of depression. This is probably got to have some good information in it. So,
Right.
What would you get out of here?
Well, this one and the other ones that you have on the table, these are brochures that are called call to action brochures that are developed by project teams. The project teams develop these brochures to determine ways to get good quality health care and also information out to beneficiaries. If they call the hotline. They can receive these variety of brochures. They're geared to depression among seniors, as well as diabetes, flu and pneumonia, mammograms, and also stroke prevention.
Yeah.
And if they feel that some little information about whatever the specific illness or injury is in that, illness would be in that brochure, when they fill it out and send it back, this is what they use to target specific areas. Because if they get a no, I haven't had my blood pressure checked from one of the blood pressure or the stroke prevention brochures, then they'll assume that if they get a lot of no's, I haven't had this done, they assume the information is not out in the community in that area. So what they will do is they'll go out and set up information stands that will have information such as the bulletins and posters. They go into the acute care facilities, the doctor's offices, the clinics, and set this information out to let patients know what's available to them as preventive services under Medicare. When they send this brochure back to our office and answer the questions and put your name and address, the postage is paid for by Impro, and they'll get a free gift in the mail for taking time out to answer these surveys, because they're real important in helping them to target specific areas.
Now, notice the postage paid.
Yes.
That's important. A lot of people will want to send something off, don't have a stamp, can't get a stamp, and say,
Right.
hey, I would have sent it, but I don't have a stamp. But
Right.
it's always a good thing when you see the symbol up in the corner and let you know it's prepaid.
Absolutely.
Prepaid postage. We got to get
Right.
prepaid postage for Just Ask. Okay. Okay, so ladies and gentlemen, please call the 1-800 number and request any of the information that you deem is necessary. We're talking about protect yourself from breast cancer, protect yourself from fluid and pneumonia, protect yourself from diabetes, depression, and stroke. So this information is good for you, and just, hey, call the 800 number, get them to send you a package, and then get some more material on it, and it's free of charge, and you get a nice free gift, okay?
Yeah, yeah.
Now this, I really do appreciate having this little card here, can you see that? MPRO card.
Yes.
Okay, this card is what someone should carry around with them in their wallet, right?
Correct. That's what we call our little immunization card. On the back of that card, it has information for medication, immunizations, and that type of information. And they can fold that card up and put in their wallet, and it reminds them who Impro is. We're your patient advocates under Medicare.
Okay.
It also reminds them to call us if you think you're being asked to leave the hospital too soon, if you received a poor quality of care, or if you're being denied admission to the hospital.
Okay.
So it
So a
reminds
person
us.
can call and just request one of these cards as
Yes,
well?
they can call. Ask for the immunization card is what they request.
Okay. This is a good card.
It is a good
Okay.
card for them to have.
Because I was under the impression that the number was on the back of the Medicaid card and, Medicare card, and people would just look back there and,
Right.
hey, dial a number.
Right.
But actually, you can have something that you can carry in your possession at all times, so that would be more helpful. Okay. And you're going to get a free gift, okay? So it's always
That
good.
always helps to prompt them to
You
send it
never
back
know
in a
what
timely
it is.
manner. Yeah.
Okay, so it gives you a good reason to have these things,
Yes,
and
it does.
I'm very pleased to have these brochures here. You can always call us here at Just Ask and get some information from us, or better yet, just call the 1-800 number and speak to Kathy Perkins and her staff and find out about more information on Michigan Peer Review Organization, as well as, better yet, have someone come out and speak to your organization. That's always an added plus. Okay,
Yes,
so
it is.
yeah, and so Kathy, we've had a chance to talk to Sarah Talley over at Social Security Administration,
Right.
and we also had a chance to talk to, I forgot the nice lady's name over at Medicaid, and it's just a bunch of you nice ladies that we get a chance to talk to, and it's a wonderful thing to have you all here.
Right, thank you.
Okay, so we're going to keep up the good work,
Right.
and have you come back again.
Thank you.
Definitely know that people will be calling you and
Right.
asking you 99 questions and stuff like that.
But that's good, because education empowers the seniors, and that's what we want them to be. We want them to be empowered when they find themselves in that situation and know what their rights are, as Medicare beneficiaries.
Yeah, and I don't understand how this information is, in my opinion, I don't know if it's out there readily enough for people to just know it when they go in. But one thing about it, after today, we will know if someone says, hey, I'm so glad I saw the show,
Right.
had a chance to hear that lady talk about when I go in the hospital to ask for this particular letter. Okay,
right.
okay.
That's right.
Don't go to the hospital without asking for that
That's
letter.
the important
Okay.
message for Medicare.
Right, you know, and I think the hospital staff would probably be pretty shocked to see somebody ask for that. And, oh, they must know that stuff. Okay,
yeah.
so it's good to know that, you know, people like yourselves are out here with this information and available to the public so that when they go in the hospital, they won't feel like they're going to put me out.
Right.
Okay, or
Right.
I'm not ready to go. I know I'm still sick.
Right.
And they say I gotta go.
Right.
You know,
And they don't think they have options.
Right. You know, and that's across the board. We really don't think we have options.
right.
Okay, I'll be so glad when our medical coverage is free. Okay. Okay, we need that.
Yes, we
But
do.
you know, please feel free to come back again.
Thank you.
Okay, and we'll get the word out for you.
Okay.
All right.
I appreciate you having me. Thank you very much.
Yep. Okay. That's just what we're going to do. Okay. Well, ladies and gentlemen, you know this is very important information here at the Michigan Peer Review Organization. And what we do here at Just Ask is try to get the information out to you about any and every services that's out there throughout the state of Michigan. If you have a show idea that you'd like to talk about, please give us a call at our number, area code 248-988-0250, 248-988-0250, our 24-hour hotline. Or you can always drop us a line and catch our address at the end of our show. You can get the address then and drop us a line, tell us what you want to see or what you want to hear about. We look forward to serving you each and every week with someone new, and so we want to thank Kathy Perkins from Michigan Peer Review Organization, as well as all those other guests that we have seen before her. So, you know who I am. I'm your host, Marcia Florence for Just Ask, and what do I always say? If you know someone with a disability, don't be afraid to ask, just ask. I'm your host. Thank you.
Ellie, your friends are here. Oh, see you, Mike. See, Ellie. I think that's the internet. Okay.
Ellie.
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 Hello.
If you had the ability to save a life, would you do it? Kidney transplantation is one of the more common life-saving procedures done today. In the United States alone, there are more than 12,000 such procedures done annually. But still, there are over 45,000 patients that wait for a donor. I know. Our family has been personally affected, and we also wait for such a donation. While we wait, thousands of these patients are forced to undergo dialysis, an artificial process developed to cleanse waste products from their blood. Even with dialysis, there are still hundreds that never get a kidney in time. Kidney transplantation from healthy, caring, and courageous donors can save the lives of many of these suffering individuals. So if you are interested in saving a life, choose to be a donor. Leave a living legacy. Thank you very much.